coming up for everybody?
Yes, it is.
Amazing. And thanks for allowing me to join today. Linda was sharing a little bit about the few times that you come together as a group for the year. So I feel very lucky and grateful to be able to be a part of this. And thanks, Linda, for the land acknowledgement as well. In addition to honoring the peoples of the land, it's wonderful to start with thinking about the connection that we have and honoring the land itself. So my name's Matteo Swartzentruber. My pronouns are he and him, and I am from the Youth Wellness Hub's Ontario Provincial Office. I'm going to try to shorten that to YHU, so I don't have to say that over and over. Our provincial team, similar to the folks on this call, are located all across the province, and I live and work on Treaty 3 lands in Guelph, Ontario. Let's see, we get the slides moving as well. So I'm here today, and I have the privilege of speaking to this group, but there's many people that have brought this model together and have contributed to this work across the province. So I always like to start with a bit of an acknowledgement and express my gratitude. So the model has developed over some time. And more than 1,000 young people and family members have contributed to its development. So through engagement, through ongoing advisories, and across the child and youth mental health sector, there have been hundreds of service providers, policymakers, system leaders who've contributed and continue to contribute to the development of the model. Research and academia is really a foundational element of YHU as we build the learning health system together. And today, as the network expands, there are network lead organizations, partner organizations, young people and family members who are really changing the landscape of youth mental health and care across Ontario. So I'm here, but those are the people that have made this happen, so to speak. I'm sure integrated youth services have come up for the folks on this call at some point in their life. There's now a integrated youth services network either in existence or in development in every province and territory in Canada and many across the world. Really, these groups are coming together with the shared vision to ensure that every young person in Canada has access to the support that they need to ensure their optimal health outcomes. And if you take a look at the map, you can see the backbone organizations represented across each province with our small but mighty Youth Wellness Hubs Ontario team in the middle there. So YHU is the backbone organization in Ontario. And our focus is support the implementation of this IYS model that focuses on free drop-in or walk-in services for mental health, substance use, physical, sexual health, and other community and social services across the province. The provincial network, so our provincial team, really works with each funded community to bring together existing service providers that serve the adolescent adult service sectors for 12 to 25-year-olds to provide service in a new way and reimagine the way the system delivers care. In addition to that, there's 5 core funded roles that I'll describe a little bit later on, which are the mental health and substance use clinicians, nurse practitioners, peer support workers, care navigators, and youth wellness facilitators that are embedded into each community to support the care provided. Again, feel free to jump in. I can't see anybody, so I'm just kind of talking to myself if you have any questions. As I mentioned at the beginning, engagement started quite some time ago in 2017. Young people and family members were consulted across the province to reimagine what the system could look like. And some key elements emerged from these consultations. One was to ensure that the services provided were accessible, low barrier, and evidence-based. Really that there should be a focus on mental health and substance use, but it needed to go beyond that. and needed to be a holistic approach to care, which included things like sexual health, nutrition, education, employment, housing, all the other aspects of a person's life, not sending them to various places, but having those things all in one place for them to access. The need for the family to be served as a unit really emerged strongly in those consultations, and that it was young people as part of that unit with their family or caregivers. The supports that were provided had to acknowledge the intergenerational trauma for young people and communities that exists across Canada and Ontario. And in shifting the way the system provides care, we wanted to reach out into the community, and the consultations really focused on the way in which service providers, these networks, could connect with young people where they were at and provide that service or care as they needed. Another key element was looking at what it looked like once the young people arrived with their family members. So making sure that youth with lived and living experiences were on staff and were able to bring their expertise as peers to their peer group, as well as ensuring that there was culturally relevant services for all young people, and that was reflective on the staff team as well. So a lot has changed since 2017. As of the spring of 2025, there are now 32 hub networks across the province of Ontario. I apologize for the tiny map. You may see your community represented on there. There have been four, this spring would have been the fifth phase of funded communities across the province. So as I mentioned earlier, the integrated youth services model brings together existing mental health and substance use, primary care, and other service providers to work together in a new and different way. And integration is a key element of this reimagination and reorganization. And it's integration on several different levels. Some key foundations of that are an integration of space, ensuring that an accessible space is built together, one that hosts multiple service providers, where everything is in one place that a young person needs and can access. And as a part of that, there's shared workspaces and there's co-location of services built in. There's another level of integration of process. As each network forms, they come together to build a joint consent form, one that, one form that all young people use when they access service. They're not telling their story multiple times. The integration of process also focuses on a shared measurement-based care platform that everyone within the network uses. And reimagining the way that partners come together as part of that multidisciplinary team to include others outside of their service organization. I've talked a little bit already about the integration of services, ensuring that everything is there outside of the youth wellness team, and it goes beyond the rec and leisure and community services and health promotion as well. And then governance is a key element of integration. Each community is funded, and one network lead organization or two organizations identified to lead that network, but they bring together a group or a governance board, which includes young people and family members, to inform the development of that network as key decision makers. So this can include everything from MOUs and service agreements to making decisions about how funding is used and that shared accountability that each network uses. Our provincial team focuses on supporting each community to develop the model, and a part of that is the implementation of the core components. So these are the essential functions, principles, or activities required for an intervention to achieve its desired outcome. And at Waihu, we have 6 core components. We started with 13 and have refined it down to 6. So I'm not going to go into each one of these in great detail, but just a high-level overview of each. The first core component is youth and family engagement. So ensuring that there is engagement of diverse youth and family members from both locally relevant cultural identities, that young people are involved, consulted, engaged, and compensated for their involvement across the network, as well as provided with skill building opportunities. It's really wonderful to see the number of young people who access service through a hub network and then are later employed as peer support workers or through a variety of roles to support the networks. The second core component is integrated governance and partnership collaboration. So as I mentioned before, this is each partner providing service has representation in decision making, and that these services are included as part of that governance table with young people and family members. In addition to that, each network comes together to develop a youth advisory council and a family advisory council that support that network and partner with our provincial advisories. The third core component is accessibility. This goes beyond access to the physical space, but looking at the service co-location, the actual location of the hub within each community, its proximity to public transportation, or accessibility to youth in a non-stigmatizing place. Then the physical layout and the space of each hubs. We have some hubs who are opening over the summer and into the fall, and it's a really exciting time there. Youth advisories are choosing furniture and have selected that physical layout, are really involved in shaping what that space will look like. The fourth core component is inclusive and culturally diverse services. So ensuring that those services reflect the population groups within each community, that there's access to French and other languages through hiring, interpretation, and translation, and that there are culturally appropriate and safe supports for all young people. The fifth core component is integrated service delivery. I think I've spoken a little bit about this. And in the next slide, we'll talk through a little bit of the service pathways. But this speaks to ensuring that all 4 service pathways are in place, that there's a crisis service protocol, and that there's a connection to or existing services across a continuum of care from low, medium, or high intensity for substance use and mental health. And the last, number 6, is measurement-based care. So I mentioned the measurement-based care platform. So all networks and their partners using these standardized screening tools, the platform, and implementing the full minimum data set. Nothing like measurement-based care to hold everybody's attention on a Monday morning. So to talk a little bit through the key features, you can see on the wheel here the 4 service pathways that are represented across the network. We have mental health and substance use services. These are generally clinicians, psychotherapists that work in this pathway. In primary care, of nurse practitioner or GP. We have education, employment, and community supports, and then our skills and well-being, which is recreation, leisure, and health promotion. So within those core components, there is a foundation, and then each community will adapt and develop its network based on the young people that are living and accessing service there. So there is this existing common menu of integrated services. We do have a focus on transitional age youth between the ages of 18 to 25. The next slide, we'll talk through a little bit about that core staffing model in our youth wellness team. You can see that there's a few other items here, measurement-based care that we've spoken about, and that really the work of that network is to engage its community to ensure that all service providers are represented and able to partake. So the 5 core funded roles you can see here, as I mentioned, it's a mental health and substance use clinician, nurse practitioner, primary care provider, care navigator, peer support worker, and youth wellness facilitator. At times, once those 5 core roles are in place, a community may adapt depending on the need of the young people. So it's not uncommon to see multiple mental health and substance use clinicians or peer support workers or care navigators, depending on what that community is needing or wanting. And when community networks engage their partners, a lot of these services are able to come in kind to ensure that the young people have the support they need. Outside of those core roles, there's further integration across community, and I like this slide because it gives a little bit more background on what that can look like in each community. We have a wide variety of network lead organizations that support the implementation of the model in each community. Everything from Indigenous-led organizations, Indigenous communities, lead agencies for children mental health, adult services, child welfare, and all of these different organizations bring their expertise, unique skill sets into how the model is implemented. But it brings quite a wide variety of available service options. Looking through some of the cultural service offerings, you can see the availability of elder support, Indigenous and other specific identity clinicians. There's cultural programming throughout each hub network. I'm not going to go through each one of these in detail, but you can see the way in which different service organizations can partner with a network to build out the service offerings for youth. We're very lucky to be part of the Federal Youth Mental Health Fund as a province. So 14 networks are additionally implementing and working with new service areas, new service providers to bring further services to young people with a specific focus on 2S LGBTQ+, Indigenous youth, Black youth, and unhoused youth. So some really exciting partnerships coming up in the near future. You can see this is more a broader picture of how that network works together. So it's not really segmented into service pathways, that this is collaborative care provided to young people as part of a whole network. There's no wrong door, there's no wrong entry point. Young people reaching out through Instagram, calling in, walking in. I've been told Facebook is for us older folks now. So a lot of different ways to access service and come into a hub network. And in addition to the various ways in which networks are integrated together, some of the core focuses of the models was really to reduce those transitions between services, ensure that they can come together as service providers and partners internally, that we can remove those silos and remove those barriers, and that there's an improved access and level of care. There are some networks that function entirely in a walk-in based model, and some that, in addition to that, offer booked appointments. But really ensuring that through the access to the health promotion and skills and well-being, we're facilitating early intervention. Lastly, we have a virtual hub that's in development. So all hub networks offer access to virtual or remote services. And there is one hub network located in Algoma is now implementing a provincial virtual hub. So it'll be an additional team that is supporting virtual services across the province and integrated and connected to all the networks across Ontario. Okay, I'm going to pause there. That's me.